Let's dive into the mysterious world of lupus, an autoimmune disease that affects millions of people worldwide. To start, we need to understand the underlying causes and risk factors of lupus. This complex condition is influenced by a combination of genetics, environmental triggers, and the immune system's role in the development of the disease. Lupus is an autoimmune disease, which means that the immune system mistakenly attacks healthy tissues and organs, instead of foreign invaders like bacteria or viruses. In the case of lupus, the immune system produces antibodies that target various parts of the body, including the skin, joints, kidneys, and brain. Now, one of the key factors in the development of lupus is genetic. There are certain genes that have been associated with an increased risk of developing the disease. Although having these genes doesn't guarantee that you will develop lupus, it does increase your susceptibility to the condition. It's important to note that lupus can affect people of any ethnicity, but it is more prevalent in certain populations, such as African Americans, Hispanics, and Asians. Another crucial factor in the development of lupus is environmental triggers. These can include things like exposure to sunlight, which can cause skin rashes, infections, and certain medications. It's believed that these triggers can initiate an immune response that, in some cases, may lead to the development of lupus. Stress, hormonal changes, and smoking have also been linked to the onset of the disease. Lastly, let's talk about the role of the immune system in the development of lupus. As mentioned earlier, lupus is an autoimmune disease, which means that the immune system plays a critical role in the condition. It's not entirely clear why the immune system starts attacking healthy tissues and organs, but it's thought that a combination of genetic and environmental factors may contribute to this abnormal response. In summary, lupus is a complex autoimmune disease with no single cause. Instead, it's influenced by a mix of genetic, environmental, and immune system factors. Understanding these underlying causes and risk factors can help researchers develop better treatment options and ultimately improve the quality of life for those affected by lupus. Moving on to our next topic, let's explore the various symptoms and clinical manifestations of lupus. Lupus is known for its diverse and often overlapping symptoms, which can make it difficult to diagnose. As mentioned earlier, lupus is an autoimmune disease that can affect multiple organs and systems in the body, such as the skin, joints, kidneys, and brain. One of the most common symptoms of lupus is joint pain and swelling. This can affect any joint in the body, but is most commonly seen in the hands, wrists, and knees. The pain is often described as aching and can be accompanied by stiffness, particularly in the morning or after periods of inactivity. Skin issues are another hallmark of lupus, with the characteristic butterfly rash being one of the most recognizable symptoms. This rash appears across the nose and cheeks, resembling the shape of a butterfly. Other skin manifestations include discoid lesions, which are round, raised, and scaly patches that can cause scarring, and photosensitivity, which is an increased sensitivity to sunlight, resulting in rashes or worsening of existing skin symptoms. Lupus can also have a significant impact on the kidneys, leading to a condition called lupus nephritis. Symptoms of lupus nephritis may include swelling in the legs, ankles, and feet, as well as high blood pressure, changes in urine color, and increased frequency or urgency to urinate. In some cases, lupus can affect the brain and nervous system, resulting in symptoms such as headaches, seizures, memory problems, and mood disorders like depression and anxiety. Additionally, lupus can cause inflammation of the heart and lungs, leading to chest pain, shortness of breath, and a persistent cough. It's important to keep in mind that the symptoms of lupus can vary greatly from person to person, and they can also change over time. Some people may experience mild symptoms, while others may have more severe or even life-threatening complications. This wide range of symptoms and clinical manifestations is one of the factors that makes lupus such a mysterious and challenging disease to manage. Now that we discussed the underlying causes and various symptoms of lupus, let's dive into the diagnostic process for this autoimmune disease. Diagnosing lupus can be quite challenging due to its diverse and often overlapping symptoms, which sometimes mimic other conditions. However, a combination of medical history, physical examination, and laboratory tests can help healthcare professionals make an accurate diagnosis. First and foremost, a thorough medical history is crucial in the diagnostic process. Your healthcare provider will ask about your symptoms, their duration, and any potential triggers. They will also inquire about your personal and family history of autoimmune diseases, as this can provide valuable information about your risk for lupus. Next comes the physical examination. Your healthcare provider will carefully examine your skin, joints, and other affected areas to look for signs of lupus. They will also check for swollen lymph nodes, listen to your heart and lungs, and assess your overall health. Laboratory tests play a significant role in the diagnosis of lupus. There are several blood tests that can help identify the presence of certain antibodies associated with lupus. One of the most important tests is the anti-nuclear antibody, ANA test, which detects antibodies that target the cell nucleus. A positive ANA test is often an indicator of lupus or another autoimmune disease. However, it's important to note that a positive result doesn't necessarily confirm lupus, as some healthy individuals may also have a positive ANA test. Other blood tests may be used to assess inflammation, kidney function, and other aspects of your health that may be affected by lupus. Urine tests can also help evaluate kidney involvement. Despite these diagnostic tools, it's important to remember that diagnosing lupus can still be challenging due to the diverse and often overlapping symptoms. In some cases, it may take months or even years to obtain an accurate diagnosis, as lupus can evolve over time and present differently in each individual. Patience and open communication with your healthcare provider are essential during this process, as they will closely monitor your symptoms and adjust their diagnostic approach as needed. On to our next topic. Let's discuss the available treatment options and management strategies for lupus. While there's currently no cure for lupus, there are various ways to manage the disease, control symptoms, and prevent complications. Treatment plans are often tailored to the individual's specific needs and may include medications, lifestyle modifications, and supportive therapies. The first line of defense in treating lupus often involves medications. Non-steroidal anti-inflammatory drugs, NSAIDs, can help reduce inflammation and alleviate pain associated with lupus, particularly in the joints. Corticosteroids, such as prednisone, may also be prescribed to suppress the immune system and reduce inflammation. However, long-term use of corticosteroids can have side effects, so it's important to work closely with your healthcare provider to find the right balance. For more severe cases, immunosuppressive drugs may be used to help control the overactive immune system. These medications can be effective in managing lupus symptoms, but they also carry risks, such as an increased susceptibility to infections. Now, let's talk about lifestyle modifications that can help manage lupus. Maintaining a healthy lifestyle is essential for people with lupus, as it can help reduce inflammation and improve overall well-being. This includes eating a balanced diet, getting regular exercise, and managing stress levels. Additionally, it's crucial for individuals with lupus to protect themselves from the sun, as ultraviolet rays can trigger or worsen skin symptoms. This can be achieved by wearing protective clothing, using sunscreen, and avoiding sun exposure during peak hours. Supportive therapies can also play a valuable role in managing lupus symptoms. Physical therapy, occupational therapy, and counseling may help individuals cope with the physical and emotional challenges of living with lupus. It's also essential to maintain regular checkups and communicate openly with your healthcare provider to ensure that your treatment plan remains effective and up to date. In summary, managing lupus involves a combination of medications, lifestyle modifications, and supportive therapies tailored to the individual's needs. By working closely with healthcare providers and making necessary adjustments, people with lupus can effectively control their symptoms and maintain a better quality of life. As we reach our final topic, let's investigate the ongoing research and advancements in the field of lupus. These efforts aim to develop potential new therapies, improve diagnostic tools, and gain a better understanding of the disease's underlying mechanisms, all with the ultimate goal of improving the quality of life for those affected by lupus. One area of research is focused on understanding the genetic and environmental factors that contribute to lupus. By identifying specific genes and environmental triggers associated with the disease, researchers hope to develop targeted therapies and even preventative strategies for those at risk. Another exciting area of research involves the development of new medications and therapies. For example, researchers are exploring the potential of biologic drugs which are designed to target specific components of the immune system involved in lupus. This targeted approach may result in fewer side effects compared to traditional immunosuppressive drugs. Additionally, stem cell therapy is being investigated as a potential treatment for severe cases of lupus, with the aim of resetting the immune system and reducing inflammation. Improved diagnostic tools are also a key focus in lupus research. Since early and accurate diagnosis is crucial for effective treatment, researchers are working on developing new biomarkers and imaging techniques to identify lupus more quickly and accurately. This may help reduce the need for invasive procedures and minimize the risk of misdiagnosis. Finally, researchers are working to better understand the underlying mechanisms of lupus, such as the role of the immune system and molecular pathways involved in the disease's progression. By gaining a deeper understanding of these processes, scientists hope to develop more targeted and effective treatments. In conclusion, ongoing research and advancements in the field of lupus hold great promise for improving the quality of life for those affected by this mysterious autoimmune disease. As we continue to learn more about the underlying causes, develop new therapies, and improve diagnostic tools, there's hope for a brighter future for people living with lupus.